Hello, I am Dr. Venkatesh. I'm a newborn consultant. This video is for mothers of newly born babies. This includes how to take care of baby immediately after birth, in the hospital, and at home. As soon as the baby is born, baby requires warmth and milk. Keep the baby warm, then put cap, mittens, socks, warm clothes. As soon as the baby is born, mother's milk is very important. First part of milk is called colostrum. Give colostrum. Colostrum is the first vaccination to the baby. Colostrum has got a lot of immunological contents, so it will fight a lot of diseases. And then this also helps in getting more and more milk in future. Once the baby is given milk, kept the baby warm, after some time, baby will be shifted to room. Baby will be with the mother for 2 to 3 days before the baby gets discharged. In the hospital, we keep checking the weight every day to make sure that baby does not lose weight. And what we see physiologically is around 5 to 8% weight loss in first 2 to 3 days time. It takes about a week or two to reach the birth weight. We keep looking at the passage of urine, motion, and every baby develops yellowness of skin called jaundice. Normally, it starts appearing after 24 hours. We screen for jaundice. If jaundice is on the higher side, we plot it on the graph. If it exceeds the normal, baby may require light therapy called as phototherapy. Then we also give immunization, BCG, hepatitis B, polio drop before baby gets discharged. Baby will have workup for newborn screening, including thyroid gland, adrenal gland, G6PD, also metabolic workup for carbohydrate, fat, and proteins. Universal hearing screening test called OAE is done. Once we are happy that baby is feeding well, gaining adequate weight, mother is happy, then baby will get moved home. Normally, mothers will ask, Doctor, what are the things we need to take care at home? Home is the best place for both baby and mother after the discharge. So keep the home clean. Hygiene is important. Keep the room warm. Make sure that good ventilation is there. Keep the baby warm, and then make sure that baby is fed once in 2 hours, and also whenever baby demands, you feed the baby. Some of the practices like squeezing the nipple of the baby, thinking that there is engorgement and milk is there to take it out, you should not do that. It is normal because of maternal hormones, the breast will get engorged in babies. Don't put powder, don't put sambarani smoke, and sometimes the blow the nose and ear. Make sure that nothing is there. So you should not do that. You should not rub the tongue thinking there are some white deposits. It's a milk deposit. It doesn't cause any problem as long as the baby is feeding well. Then keep an eye over activities. Is the baby feeding well? Baby is active, moving all the four limbs, passing urine motions adequately. Then you need not worry at all. Then whenever the doctor has asked you to come and show again, usually we ask within a week time to come and show for two reasons. Is the baby adjusted to home atmosphere? And just to look for jaundice and to look for any other complaints mother has. And of course the weight. Mother's milk should be continued till 2 years of age because the complete myelination happens at 2 years of age. After completion of 6 months of age, mother's milk should be complemented with weaning food, what we call complementary feeds. Culturally acceptable food should be started after 6 months. Usually in southern part of India, ragi is started. I'll just give you how to prepare ragi. You take clean ragi, wash it with water, and pack it in a cloth, tighten it. Next day morning, it gets sprouted ragi. Sun dry or roast it. If the quantity is small, you can pound yourself, or if it is large, you can mill it. You take a muslin cloth, sieve it, you get fine powder. You put it in the airtight container, take 1 spoon of it, cook it in water in such a way that it should neither be liquid nor solid in consistency. It takes a type of the shape of the tongue. Then you feed that. After 3 4 days, take moong dal, roast it, powder it, put it in an airtight container after sieving. Then 3/4 of ragi sari, 1/4 of moong dal. Better not to use much salt and sugar within 1 year of age. Then small banana, what you call eleki banana, you can start. One fruit juice, that is apple juice, can be started. One cooked vegetable, green leaf vegetable, can be started. And slowly, you don't put everything together and cook. So always one at a time. Ragi sari, then moong dal, vegetable. Then because if the baby becomes allergic, we don't know what which baby is allergic to. So slowly you just once baby is used to the cereal, pulse, and vegetable, you can prepare khichdi at 7 months or so. Then gradually small soft idlis, neer dosa, something, you can start. Then at around 10, 11 months, family pot diet can be started. Of course, the vaccination, once BCG, hepatitis B, polio drops is given at birth before baby gets discharged, then immunization schedule will be given to you. Follow that schedule, usually 1.5 months, 2.5 months, 3.5 months, and then doctor whom you visit will be talking to you about the next vaccination. Of course, each visit, weight, length, head circumference should be monitored, and then that will be monitored, and also that will be recorded on the graph. And every time, dear friends, make sure that the graph is brought to the doctor when you come for the vaccination, because you need to look at the baby's growth and development. There are 4 domains in development: gross motor, fine motor, social, language. All these things will be actually checked at each visit when you come to the hospital. So in the nutshell, take care of baby, feeding baby on mother's milk at least for maximum of 2 years. Weaning food should be started after completion of 6 months. Until 6 months, only mother's milk. Nowadays, we start vitamin D3 drops 1 ml once a day, and you can continue until 1 year of age, or as advised by your doctor. And another important concept: once the baby is discharged from home, make sure that baby is not exposed to gadgets like mobile, television, computer, and you avoid those things, then baby will become so emotionally bonded to you. Most of the times we see mothers talking using mobile along with the baby feeding. Don't do that. And baby should not look at the mobile, television, computer at least for 1.5 to 2 years. And mostly at home, what happens, the grandparents on their lap, they keep the baby and keep watching the television. You should not do that. So less utility or no utility of these gadgets. And you always look at, make sure that you spend time for 2 years only the baby. Think that baby is everything. If you want to use mobile, make sure you can go a bit far for the baby and then talk. And mothers, especially in the initial 6 months, make sure that you don't use mobile. You can give your mobile to somebody else. They can answer your calls, whichever you get. So the growth of the baby, development of the baby, and the overall development all depends on with you. I have seen my OPD, a lot of parents coming, doctor, my child always uses mobile. And if he say something, he gets anger. He throws mobile. Who is at fault? Baby is not at fault. We are the ones actually who give mobiles, everything, whatever they want, we give. And the end of the story, we suffer. So, hence, keeping the baby warm, adequate nutrition, that is mother's milk and complementary feed at 6 months of age, vaccination is scheduled, and spend more and more time with the babies. That is the thing actually you can contribute to your child. What I can contribute to my child is not the gadgets, not the money, it's all the emotions. Through what? Through mother's milk. So today's healthy baby will become wealth to the nation tomorrow. Thank you so much.